Does your baby vomit curdled milk? In this video from AllForBabies, we'll tell you if it's normal and when you should be concerned. Why does a baby vomit curdled breast milk? We shouldn't be alarmed or worried if we see that the baby has vomited or regurgitated milk with an appearance as if it were curdled, with a sour or strong odor. Sometimes, the milk appears like this with those small lumps because it has simply mixed with the stomach acids. This can happen whether the baby is fed breast milk or formula, but this fact is not harmful to the child in any way, as long as they don't present any other symptoms and their overall condition is good. Is it normal for a baby to vomit milk? It's normal for babies to regurgitate part of their feedings to a greater or lesser extent, especially if they are only a few months old and are exclusively fed milk. Regurgitation occurs when the stomach contents come out of the mouth without force, in a non-abrupt manner, and without causing pain. In fact, babies don't even notice. Some babies have a lot of esophageal reflux, causing distress in parents. But it requires a lot of patience, as this will pass with time, as it is due to the immaturity of the digestive system. However, if it is actual vomiting, it is not a situation within normality, and it indicates that something is happening in the baby's body and needs to be evaluated by a doctor to determine the cause. We differentiate it from gastroesophageal reflux because in this case, vomiting occurs with effort from the baby and sometimes accompanies abdominal pain. It can be due to gastrointestinal infection, intolerances, or allergies. What to do in case of regurgitation? First, burp the baby. After each feeding, it's necessary to help them burp. Then, keep them in an upright position for at least about 20 minutes. Also, don't move them too much after eating. Use clothing that doesn't compress the baby's abdomen, and elevate the mattress slightly at the head. If reflux occurs because they eat excessively, offer milk more frequently but in smaller amounts. What to do in case of vomiting? The most important thing is to hydrate the baby. Offer breast or bottle more frequently, and if they are older and have started complementary feeding, oral rehydration solutions can also be used in small sips. Medications to suppress vomiting should not be administered unless prescribed by a doctor beforehand, as they may harm the baby. Likewise, in case of suspicion of a food allergy, you should eliminate that suspected food until you finish breastfeeding. If any of these situations occur, it will be necessary to visit the pediatrician. If the baby is not gaining weight, is very irritable, refuses feedings, wets fewer diapers, appears listless, has a fever, develops skin rashes, or vomits very frequently, repeatedly, and relentlessly, with green color or traces of blood. If your baby vomits curdled milk, as much as you may want to feed them because you think they will remain hungry, the most advisable thing in these situations is not to give them anything to eat or drink until some time has passed, as otherwise, it's likely that their little stomach will tend to expel its contents again, causing even more irritation. So, the most prudent thing is to wait at least 30 minutes without nausea appearing before offering them something to eat again. See you in the next AllForBabies video.